So those of you who've looked or seen all of the tapes that we have expressing various views about HIV, what's happened in the past, what may happen in the future, may feel that the war against HIV is over. We have highly successful drugs, we have an aging population, but still there are fights for us to ensure that the HIV patient does well and to make sure that this epidemic doesn't continue to grow. If you look at the number of people who die from HIV worldwide every year, it's still in a couple of millions. And if you look at the number newly infected, it's even greater. So are we truly winning the war against HIV? We need to make sure on several fronts that we continue the fight. We need to make sure that individuals are diagnosed. We need to make sure that the stigma around an HIV diagnosis, the fear of coming for an HIV test in case it is positive, is disappeared. How do we make it disappear? That's all up to you. Reducing stigma comes both from the individual and from a population. We need to make sure that individuals living with HIV, whether they be in Western Europe, whether they be in the developed world, in the developing world, are treated the same as any other human being. We all have millions of viruses living in us. The HIV positive patient has millions plus one, that's all. And we need to make sure that people are happy to be diagnosed. Once you're diagnosed, we need to make sure that individuals have access to care, that they have access to treatment, which is going to ensure that they live a healthy life. And you will have heard that individuals living with HIV should, and indeed deserve, to have a normal quality and quantity of life. We need to make sure that the drugs are available. People will make mistakes. In some cases, drugs won't work, in which case we need to make sure that individuals have access to newer techniques. They have access to newer drugs to allow the fight against HIV in that individual to develop. We also need to make sure that we're aware that in an aging population, whether they have HIV or indeed without HIV, that we are able to fight the other problems that we see in an aging population. Heart disease, liver disease, kidney disease, bone disease. They may all be increased in an HIV population, and that individual with HIV needs to get the same high standards of care that someone who is HIV negative has. So don't think the fight against HIV is over. I think sometimes it disappears. When I was a junior doctor, on the television it was full on World AIDS Day of HIV stories. It was affecting the famous. It was affecting the rich. It was affecting the poor as well. But it made stories. Nowadays, people living with HIV, normal quality, quantity of life, where's the story? Well, the fact is every individual living with HIV has a story to tell. And we need to be aware of those stories and continue to fight to reduce stigma and to improve the lives of those living with this infection.